Dr. Malika Shah. She's the medical director of the newborn nursery at Northwestern. Um, is it medical hospital, Dr. Shah?
Northwestern medicine. Yeah.
Thank you.
Yeah,
Go
of
ahead.
course. So thank you so much for the opportunity to present today. I am going to be taking a slightly different approach to this and kind of focusing more on the nursing perspective. I have nothing to disclose. As you all know, over 25,000 infants are born to mothers diagnosed with hepatitis B each year in the US. And we know that administration of the birth dose is highly effective, but that fewer than 75% of infants receive that dose in their first 3 days of life. Vaccine hesitancy and refusal have steadily increased over the last few decades. And a missed dose, birth dose of hepatitis B is actually a risk factor for incomplete vaccination at both 18 and 24 months of age. So, sort of delaying that trust in the medical system or what have you is actually a risk factor for additional diseases as well. To be honest, the challenges extend beyond vaccine hesitancies for many birthing hospitals. This is just a picture of Northwestern Medicine, the Prentice building, where there are over 10,000 deliveries every year. Um, and one of the things that I just really wanted to point out is all the newborn tasks that just keep getting added. Yesterday, we had a really nice presentation where one of the presenters actually said that nobody had actually even talked about the hepatitis B vaccine in her entire stay with her newborn. And we wonder, right, why? And so here we have like our little welcome packet to the Prentice postpartum unit. And what we have are basically infant security that we need to talk about, infant feedings that we need to talk about, identifying help at home, a pediatrician visit within 24 hours, making sure that that's established, pain management in the mom that is not just one time, but that is done on a sort of a continuous basis every time that vital signs are checked, the hepatitis B vaccine, which we want before 24 hours, a bath, and also teaching the family how to give a bath, the metabolic and PKU screen, the congenital heart disease screen, a couple of infant weights, the hearing screen, which is now standard throughout the United States, a jaundice and bilirubin screen. We also have educational videos that we really want the parents to watch. We oftentimes offer a newborn photo shoot. If we don't have that happening, it probably is family members that are wanting to do that. Car seat and transportation safety. We actually have a very active safe sleep initiative going on in our unit right now. To educate every parent on sort of risk factors for SIDS. Folks will come in to do a birth certificate and Social Security. We need to recheck on that pediatrician follow-up appointment to make sure that it's been made. And oftentimes we have a discharge class as well that we request that families go to. So if you add all this up, you can see that it's going to be 10 hours or even more if you get into a longer discussion about any one of these topics. Well, meanwhile, the length of stay has really, really gone down in the United States. So in the 70s, a C-section, the average length of stay was kind of almost close to 8 days. And the length of stay for a routine vaginal delivery was close to 4 days. And now our C-sections are typically about 4 days. Oftentimes in our hospital, our goal is really just 3 nights. And our vaginal deliveries are, sort of between 2 and 3 days, no more than 2 nights. It actually, insurance doesn't even cover more than 2 nights unless there's a complication in the mom. So, as you can imagine, in these really short hospital stays, it is becoming increasingly difficult for nurses to do everything that they're not only required to do, but also required to document. So, with these newborn tasks that just keep getting added, what we did was we put a bunch of the tasks, all of the ones that are in green, and put them into what we call a 24-hour bundle. Um, it's called a cluster care initiative, and it was developed by two nurses, Shannon Blair and Haley Gillespie, who I really want to give a shout out to. And it was initiated in 2020 to standardize care within the baby's first 24 hours. So basically, at 23 hours of life, we were going to immediately go in, give the Hep B vaccine, and that consent should already have been obtained, do the weight and bath, and then after 24 hours of life, which is sort of mandated by policy, we were going to do the congenital heart disease screen, the metabolic screen, and then in 2022, we actually added a jaundice screen to this as well. Um, this, just so that you all know, is not for anybody whose mom was Hep B positive. Of course, that would occur much, much earlier. And then we researched it to see, is this even helping? Because so often we come up with these plans, we try to do something, and we really don't have any evidence that it's really actually helping anything. So we looked at whether the 24-hour baby bundle was effective at increasing rates of hepatitis B vaccination within the first 24 hours, whether it was more effective at delivering cluster care for specific patient populations. As Dr. Blair and others have pointed out, there are specific populations that do tend to decline vaccination more or delay it more. And then are there parent demographics in these that decline the hepatitis B vaccination for their infant? So our study design was 22,057 infants born at Northwestern Medicine. We had pre-intervention birth dates, which were from February 16th, 2019 to January 16th, 2020. We had a washout education period that was about 2 months. And then we looked at post-intervention birth dates from March 17th to February 16th, 2021. And we really did see some notable changes. So our 24-hour baby bundle was implemented in February of 2020. And prior to that time, we had probably around, I mean, it varied from month to month, but about I think it was a 43 or 46% vaccination by 26 hours. And by 24, after in our post-intervention period, it significantly went up to over 60%. So you can see here that within 24 hours, it increased significantly from 43% to 60, almost 67%. And our hepatitis B immunization prior to discharge significantly increased as well. Now, we were at a very high rate already, 98.18% versus was pre, and then post was 98.82, but that was also statistically significant. Our intervention outcomes by maternal race really were positive across the board. So for white, Caucasian, Asian, Black or African American, Native American, Native Hawaiian or Pacific Islander, and or multiracial, they were all statistically significant. And we did also look at the parents who refused vaccination. We did find that those who refused, to Dr. Blair's point, when it's just presented as routine standard of care, it did decrease after the 24-hour baby bundle. It's from 1.82% to 1.08%. I know that seems really small, but when you have a population of 10,000, that's actually quite a few babies. We did find that those who refused vaccination were more likely to be multiparous, 64% versus 52%, were less likely to use formula during their admission, and were far, far more likely to decline vitamin K, almost to the magnitude of, I mean, an odds ratio, I think, of over 20. So those who declined vitamin K were also very, very likely to declare hepatitis B. So where do we go from here? Well, what we know is that implementation of a 24-hour baby bundle improves time to vaccination, overall vaccination rates in our large hospital, and that it's effective across all patient demographics. What we need to study is whether this intervention is successful within other communities, specifically those with lower baseline newborn vaccination rates. It sounds like Kentucky's doing a really, really good job at moving this forward. I don't know if there's other populations, and certainly across the world as well, if there are opportunities there. We weren't able to analyze the impact of bundling care on cost savings and staff satisfaction in the newborn nursery. We were able to look a little bit at length of stay, and it didn't really cause a huge difference. But again, we're very much under the gun to get our babies out very quickly, to get our mamas out very quickly as well. So we had kind of already done a lot of work on that. I wasn't terribly surprised that this didn't make it that much different. It did really help with babies that are either transferred from the NICU or have a lot of other issues going on to just sort of have that 24-hour mark as a time when to make sure that all of these things are done, almost like a set point. And what we can do today, I'm bundling care in sort of the adult ICUs in many other aspects of medicine has really been shown to to increase compliance. And our bundling care definitely reduced periods of separation between infants and families. We need to continue to emphasize the importance of timely administration of the Hep B birth dose vaccination in preventing infection. I really want to highlight what was said yesterday. It can be really too late, I think, and a huge burden on nurses to start that in the postpartum period. It probably makes a lot of sense to talk to OBs, to talk to moms beforehand, so that when this happens, it isn't a surprise. And then obviously continue to educate patients on the importance of vaccine compliance for newborn health, meaning keeping on the schedule so that babies are completely caught up. And that is all I have. I have some references if folks are interested. And I really want to acknowledge the medical student who's now graduated and is in her OB residency right now in Pittsburgh, the nurses who came up with this, and the coalition for inviting me to speak. Thank you.